Praise the Lord. We give God all the glory. I want to personally appreciate God for this opportunity and also thanking Him for the life of each and every one of us. Also want to express our gratitude to the district pastor and then the executives of PIWC DN. Not to escape, I want to personally thank our boss, the Health Guild, and also the Workers Guild Coordinator of PIWC DN in the person of Dr. Philip Yineku. God bless you so much for this opportunity you have given us. And I know that my colleagues and senior colleagues are all here. They will join us in this presentation. And along the line, you will see them among you trying to guide you on how to do some of these first aid tips. So 3 John 2. 3 John verse 2 says, "Dear friend, above everything, I want you to prosper and be in health, just as your soul prospered." However, Hosea 4 verse 6 says, "My people are destroyed for lack of knowledge. Because you have rejected knowledge, I will also reject you, so that you will not be a priest for me. Since you have forgotten the law of your God, I will also forget your children." I pray that this will never be our portion. So, is God's plan that we all be in good health. But good health, you need to also acquire knowledge so that certain things you don't see yourself or you don't fall short to it, which will claim your life early. So sometimes I do say that some deaths are foolish deaths when you don't take the necessary precautions. So this morning I pray that we all acquire this knowledge and it will help us wherever we go. The unfortunate thing about first aid is that most of the time when you learn it, you apply it on somebody. But some will also help you yourself. So I pray that God will give us the grace to go through. It's quite enormous, but I pray that we will be able to go through. Please, media, can you help us with the presentation? So when we say first aid, please, can we go on? Okay, so when we say first aid is just any emergency or immediate or temporary care that you can give to somebody, or treatment that you can give to somebody who is suddenly injured or having a sudden illness, with the primary aim that you want to preserve the life of the person. So that is the basic reason why we do first aid, that we want to preserve the life of the persons. And there are other reasons why we do first aid, which may include preventing the condition of the person from getting worse. There are certain conditions, if you attack it or you address it as early as possible, you prevent future or other complications from coming in. For example, if your child is having fever and you know the kind of first aid to give, if you give it as early as possible, it will prevent the child from convulsing or having seizure, and which may damage the brain of the child or even result in death. So first aid is very important. There are some few kits or things that we should have in our homes as a form of first aid kits. Because we don't have much time, I'll just mention them. Otherwise, I would have gotten your views from that. Some may include bandages and dressings. Dressings like the things we use for dressing wounds in the form of cotton, gauze, dress ointment or solution. Dress ointment is just when you go to hospital and you are having a wound that looks like red, or let me say somehow red, that they pour in the wound, is what we call dress. But the real name is iodine povidone, and that is what we use to dress the wound. So you can have that, or have penicillin ointment. Is also good for wounds, Lexporin ointments, they are all drugs we can obtain from the pharmacy without prescription. When you go and you ask, they can give it to you. We have other things like simple medication like paracetamol, which we should all have. If you have a child in the house, especially under 5 years, it's advisable you get the syrup and also the suppository, the one, we insect in our anus for the babies. You have to get that in your house. So every mother must have paracetamol syrup and also the suppository in their freezers, so that in terms of emergency, you can apply this. Then you must have gloves and nose masks or face masks. You can also have antiseptics like Dettol or Savlon. Savlon is just like Dettol, but that one is yellow in color. We use it in almost every part of external body, not internal. We don't use it inside, but outside for cleaning and disinfection. Sometimes we even advise, if you are someone who is prone to suffering from skin rashes, you can put a drop in your water and use it to bath every day. You can also have some medical tools like thermometer, especially for the mothers. Thermometer, if you can afford, get a sphygmomanometer or what we call the BP apparatus. Now we have digital one, a lot of them. You can also get a glucometer and strips, what we use to check our sugar level. I'll try as much as possible to remain in the English terrain so that I don't take you so much into the medical terms to confuse you. You can also have ORS and mentholated spirits or sanitizer in your home. Now I want to look at basic principles or philosophy of first aid. When we say first aid, it's all about just some few simple things. And by the end of today's presentation, that is all that I want you to keep in your mind, that whenever you have an emergency, you apply these techniques or these philosophies and you are good to go. The first on the list is look out for danger. Whenever there's an emergency, look out for danger or safety. Looking out for danger or safety, it doesn't necessarily mean that somebody is coming to kill you, but you want to see where the person is. Is it safe for me to administer my first aid? It may be that the person have gotten electrocution. You cannot save the person right there where the person is connected to the electrical gadget or something of that sort. So you have to check whether the place is safe. You can find somebody who has collapsed along the line or along the way. It may be a gunshot from somewhere. Is it safe for you to operate at that very moment? So safety is very important. And all these things, you have to do it in seconds, not in minutes, in seconds. Now, after the safety, you call for help. You call for help. So calling for help, maybe your child has gotten choked that very moment. Anyone around you, you shout and call the person for help. Sometimes you meet the person outside or even right here, something happens. You call on the phone, call for help. If you are alone, you can call your phone. It should be fast and quick. So once you call the person, you put it on a loudspeaker and then you attend to the person. And when the person picks, you talk. But you don't only say, oh, let me finish calling after talking to the person, then I'll come back. No. So it all happens within a short time. Now, the very basic principle itself is ABC. So we call it ABC, principles of first aid. The A stands for airway. When you get somebody in emergency, the first thing you want to look for is airway, then breathing, circulation, and bleeding control. I'll talk about them as we move on. Now, you have seen I want us to tackle the first emergency, a sudden collapse. You got somebody who has suddenly collapsed in your midst. What do you do? May I seek your view? If you meet somebody who has just collapsed, what will you do? First thing you should do. Hello? Can somebody help us so that it will not be boring? Can you help us with a mic? Somebody has just or imagine as I'm talking to you, I just collapse. What will you do? Okay, please, no health worker should answer. Oh, please, give the mic to someone to answer.
Okay. Thank you.
Okay, sister.
I'll try and check the person's pulse.
Okay.
And heartbeat. And
Okay.
also try and remove any tight clothes around the neck. And ensure that it's not around a place where there's danger.
Okay. Let's clap for her. Let's give it out to her. God bless you. She has done very well. Any more? Okay.
I'll pour cold water on the
person. Okay. Did we hear what she said? We didn't hear it. Okay.
She said you pour water on the person.
You pour cold water on the person. You have to wake up. Okay. That's good. Let's clap for her too. That's good. Okay, so let's move on. When you meet somebody who has suddenly collapsed, first thing you should do, what did I say should be your first thing? Check for safety or whether there's danger there. Then, what do? Call for help. So you call for help. Can somebody help us? Somebody has collapsed here. Can somebody help us? Then they come around. Now, we say A, B, C. The first thing, A. And these principles, if you get them, the rest of the presentation will just be very simple. So I'll ask Sister Vic, yes. Unfortunately, we wanted to use a dummy, but we couldn't. It was engaged. So she'll be my dummy for today. Okay. So she has collapsed. What do I do? I've checked safety, danger, and all those things. Somebody help me. Who will help me, please? Oh, I need help. Nobody's helping me. Okay. So, A. Okay, I've gotten 2 helpers. So, A. I'm going to look for airway. Airway. I want to see whether air is entering the person. Okay. So, the first thing, where do we breathe through? The nose. Is there any other place? The mouth. And that is a bigger place. A bigger place we breathe through. So the mouth. So I want to check from the mouth whether there's something that is blocking the airway. Airway is just the windpipe that we have, what we call trachea or windpipe. Okay, so I want to see whether it's blocked. So quickly, I tilt the head back. The very moment, please, you are conscious. Because an unconscious person, when I tilt the head back and I open the mouth will open. But since she's conscious, she's controlling it. So I quickly check whether there is something there. So checking the airway, we watch, we feel, and we listen. What did I say? We watch, we feel, and we listen. How do we watch? I watch inside the mouth to see whether she's what? The airway is blocked. But before then, I checked. I just found her collapsing. Sister, I've called to see whether she is conscious. Then you tap from the chest, press it a little, the shoulders, press it a little to see whether she'll respond. Since she did not respond, I'm checking the airway, tilt the head a little, open the mouth, and check whether there is any block over there. So I've watched, I've looked. Now, the listening. When I called, if she were to be conscious, I will hear it. Okay? Another thing is that if somebody is having a blocked airway, you will see the sound of the breathing. There will be a noisy sound. In medical terms, we call it stridor. When the person takes in breath, you may hear something like that. So that is why when we sleep, unconsciously, part of the system that, control our consciousness affects our breathing, our airway. And since it is a little relaxed, it causes sometimes we have this kind of snoring when we do what? We sleep, okay? So since she's unconscious, sometimes you may be hearing, as she's trying to take in air, you may be hearing some sound and will tell you that this airway is blocked. If it is blocked, for medical safety's sake, if you have gloves, put on your gloves and then use your hand and sweep inside. Sweeping inside means you have opened the mouth, use your hand to pull out if there is something there. Mostly the things you will see over there may be vomitors. Maybe since the person is unconscious, The person might eat. So some of the food inside may come out, which we call regurgitation, and you may find some in the throat. Or even the tongue itself can fall back because you are unconscious. So it relaxes. So when you sweep inside, you can bring back the tongue to its position. Are we okay with airway? So if you don't have gloves, if you get any rubber, okay, Benko rubber is very common. Just get some and put on your hand for emergency sake. Are we okay? Heading. Okay. So that is it to prevent. But if you don't have any cut on your hand, hello, if you don't have any wound or any cut in your hand, you can just go in there. What you want to do is save the life of the person at that very moment. So we have dealt with A. We looked. We what? We feel. And then we did what? We listened. Now we are going to B. B is breathing. I want to see whether my sister is breathing. How do I do that? You look, you listen, and you feel. Or look, feel, listen. Now, how do I do that? How do you know that somebody is breathing? Oh, how do you know someone is breathing? Oh, you see the chest of the person rising and falling. So that is what I do. I am watching. So with my ear closer to her, I'm watching the chest and I'm checking whether she's breathing. From here, the chest, you will see the rise and fall of the chest will tell you that the person is breathing. Now, I drew my chest cheek closer to her because, or you can use the back of your palm. Can we all feel it? Get it closer. How do you feel? The warmth. So you see the warmth and know that this person is breathing. So if the person is not breathing, it may be the airway. Then you go back to your A. But if the airway is clear, then you have to go to the next thing, which is C. The C is circulation. Circulation is just to know whether the blood is flowing through the person's body well. How do we do this? How do we check? The first of all is we check for pulse, as my sister said. Today, we are all first aid, practitioners. So we will be practicing how to check first aid or how to check our pulse. And this one, if you learn it for yourself, it will help you. Every morning when you get up, check your pulse. This is how we do. Take your 3 fingers. Can you all show me your fingers? These 3. Bring them closer together. Let them be closed. Okay. Now, pick your second arm. Use the thumb as a reference point. And with your 3 fingers closed, just beneath, the thumb, bring it there and press it on it. Please, the health workers around, kindly guide them for me. So the 3 fingers, there is a line there. Just under the wrist, next to the wrist. Put it on it and press it. Press it. Can somebody feel it? Press it deeper. Don't just put it on it. Press it harder. But it shouldn't be too hard. Otherwise, you cease the pulse from breathing. Can we all feel it? Have we tried it at all? What can you feel? What is it? Somebody is doing like this. Okay. What else? Please, who is not able to feel it? Is somebody here who is not feeling it? Anyone? It means all of us have felt it. Oh, okay. Please, you help them around. Help them around. Okay, that's one for the meantime. Unconscious. She's even checking. Okay. Hello. So that is our pulse. That is how we check our pulse. The health workers will be around to help you feel your pulse. Now we have a normal pulse, which is from 60 to 100 beats per minute. Now, when you are able to feel your pulse, this is what you do. You have to use a second clock, just like the one here. So, let's say when it gets to 3, we start counting. 1. So, as the pulse counts, boom, boom, you count it. 1, 2, 3. You count it like that throughout until it meets the 3 again, and that is 60 seconds. Then you record what you have counted. But in terms of an unconscious person or somebody who has had sudden collapse, you just want to feel whether the pulse is present. Okay? Apart from here, there is also another place where we feel the pulse, which is around behind our ear here, the neck side. If you put your hand there and press it, you will feel it moving. There is also another one, which is around this side. Okay, so we have different places we feel our pulse, but the commonest is the brachial pulse, which is the one on our wrist. Okay, now another thing where we can check circulation is what we call capillary refill. Can we say it? Capillary refill. It's just simple. You take the finger, especially the index finger, you press it. Can we all do it? When you press it, what did you see? Still hold it, pressing it. What do you see? What happens to your nail bed? Is what? It means you have released it. I said hold it. What is it? It's white. Now release it. The very moment you release it, what do you see? Blood going back there. So that is what we call capillary refill. If you do it to a person who is unconscious and having circulation problem, within the first 3 seconds, it will not come back quickly like that. And you know that the person is having problem with circulation. Then the next principle is bleeding. Bleeding, which you want to look out for. And that one you check physically, watch around and see whether the person is bleeding from any part of the body. Because if you don't arrest it, the person may go into shock and may die easily. So these are the basic principles. All that we are going to do is going to follow this. So when I reach those places, I will not explain it again as I did. We have seen how we check airway. We have seen how we check for breathing. And we have checked how we check for circulation. Now, when there is a problem with the circulation, that is what we do. We call CPR. Shall we all say it? CPR. CPR just means cardiopulmonary resuscitation. We will come to it and do practical at the end of the session. So somebody who has suddenly collapsed, it may be that there is a fast or rapid drop in oxygen supply to the brain and the organs, or there is glucose reduction or supply to the body or the brain. So the person collapses all of a sudden. However, there are different causes of sudden collapse. We have a heart attack, cardiac arrest, hypoglycemia. When the person is having low sugar, the person can collapse. We have even infections like meningitis and many others. Somebody with severe anemia, the person is not having enough blood, can collapse. Somebody with hypotension, when the BP drops more than the normal, you can collapse. So we have different. I think after this, we will bring out the slide so that you can get it. Now, how do we manage it? How do we manage sudden collapse? I've mentioned it. Check for danger, call for help, check for consciousness of the person, airway, breathing, circulation, and then bleeding. Then you do CPR. If all this fails, then you keep the person warm by covering the person. That is when you have resuscitated the person. Resuscitation just means that you have brought the person back to life and the person is breathing. So that is what you do, and you let the person lie in a recovery position. Recovery position, mostly we do it in a way that the person lie with the hand, one hand this way, and the leg also in an angle. I forgot to add the picture, which it could have been very simple. Or let the person lie flat and you tilt the head at a side. The reason why you are making the head to go the side is that it will prevent any, okay. It will prevent, if there is any secretion. Can you lie in a recovery position for us? Okay. Yes, lie. Okay. So this is you lie the person in a how do we call it? A sideways. Now, lie in the flat way. Okay. Oh, okay. So For the person, when the person is lying flat, this is what I mean. You tilt the head this way. Can we all see it? With the mind that anything within the throat will drain out. So the recovery position may be a challenge for non-health practitioners, but this is a best way of positioning the person, where the head will be tilted sideways to prevent the tongue from falling back and also prevent what we call aspiration. Okay, thank you very much. I'm trying hard to meet our time. Now, what we don't do, don't panic. If somebody just collapse, don't panic. Hey, then we all shout. Yes, then we all shout and there is panic. Don't panic. Don't also overcrowd the person. Don't overcrowd the person. Give space so that air can reach the person. And then you don't pour. Oh, you don't pour. Please don't pour water. That is one of the biggest challenges we normally face at the hospital. Person collapse, they'll pour water on the person nicely. By the time the person gets to the hospital, it's gone. Don't sprinkle water on the face of the person. I wish time will permit to tell you the pathophysiology behind pouring water, but time will not permit. But what happens is that it changes the system of the person and it even kills the person faster. So let us not do that. Do not leave the person until help comes. Don't leave the person. Shout, call, and don't leave the person. Now, let's go to fever. Fever is a common thing in our homes. And fever is just having a body temperature or the body temperature rising above 37.5 degrees Celsius or 99.5 Fahrenheit. Now, there are a lot of causes of fever. I don't want to bore you with it. So we all know the signs of fever, that your body becomes warm. Sometimes you may be shivering. It may come with bodily pains and all other things. The heart may be pumping faster, and then you may be restless. And especially in children, they become confused. What we normally call high fever. You will see them talking and saying unnecessary things that does not have meaning. Then we say the person have gotten high fever. It's mostly common when they have malaria and typhoid, very common in our homes, but there are other causes. What do we do if somebody is having fever? One, allow air to blow around the person. You don't cover the person, especially for babies, especially newborns. The baby is warm, and we still wrap the baby in a lot of cold sheet and cloth. You are killing the baby. So when your baby, especially newborns, those beyond 28 days, when the baby is warm, don't wrap the baby like that. Just one cloth will be okay. Okay. Now you loosen the clothes around the person, and then for babies, you continue breastfeeding. Then you do what we call tepid sponging. Tepid sponging. I know mothers are very, very familiar with this. When they go to the hospital, they'll tell you the child is warm, go and pour water on him or go and bath the baby. Yes, adults too, we do tepid sponging. But there is a way we do it. Let us all learn it, especially our fathers. Let's learn it today. If you want to do it, you don't start from your head. You start from your feet. So start introducing the water to the feet gradually. It's even best that you put something in a towel and use it first before you even bring the water off. So a wet towel, start from the leg or the feet, then gradually you climb to the top. Are we okay with that? Okay. If it is yourself, make sure you start bathing from the feet to the top. So I want to use this opportunity to also advise ourselves, especially the men. When we go to the bathhouse in the morning, how do we bath? First thing, water on our head. It's wrong. It is wrong when you go to the bathhouse and you pour water on your head first. So you start for your feet so that your feet will get grounds and then you continue to bath. Now, when you are diagnosed of malaria or any infection that is giving you high fever, please, in the night, especially our partners, don't sleep. Use this tepid sponging. It helps bring the infection down a lot, especially our babies. Now, this is what you do. You look for areas that temperature normally stays. Our armpits, under our neck, our private parts, even in between the how do we call it? The thighs, the knee, there, and then the elbows, then our forehead. So after tepid sponging, pick a towel, put it in water, and put it those places that I've mentioned, and alternate it till the body is cool. Now, when there is fever, this is what we do not do. You do not tepid sponge from the head. I've said that. You do not combine paracetamol and brufen. Sometimes, because we want the temperature to come down as quick as possible, so we give para and give brufen and even sometimes aspirin. And we also don't give aspirin to children under 16 years. If somebody is having asthma, you don't give the person aspirin. Are we okay? Okay, I'll rush for the rest of the distance. Then convulsion. Convulsion is just the unconscious, or how do we call it? It's characterized by a violent movement or disturbance, how do you call it, of the body. It can be parts of the body or the whole body. So we can see the lady at the top may be having a mild seizure. So sometimes the seizure may come with just the face. You may see the face going like this. Something like that, and it's a seizure. Or the hand may be shaking involuntarily. Okay. Then this is a chronic one, or somebody who is having a high form of seizure. It's a medical emergency when you see something of that sort. What do we do? I will not talk about what causes it. We know the symptoms already. Sometimes we may see foam coming out, or the person will be biting or chewing the tongue. Okay. This is what we do. What is the first principle? Safety. So you check around whether the person where he's staying is safe. Is there any fire closer? Is there any object closer that can harm the person because they are unconscious? If there is something of that, remove them from there. Put a soft cloth under the head, because when they, how do we call it, they convulse, they may be hitting their head. So something soft under. Don't restrict the person. Don't hold the person down to stop. No, you will disturb. So just allow them, put the cloth and guide them gently till the seizure is over. But don't forget, call for good. Losing any clothing that is around the neck, especially if it is a man and is putting on a tie, quickly remove the tie, because it may choke the person. And maybe the first or two buttons to make the person free. When the person is convulsing, don't pour water on the person. Another one. And then you don't put spoon in the mouth of the person. Are we okay? It's very dangerous. In the same way, fever, I want to recall that after you have brought the fever down, don't stay in the house. Please go to the hospital for them to check what is causing the fever and treat it. Otherwise, it will come back. I want to quickly move to choking because of our time. Choking. Okay, so choking is just the airway, which we have spoken about, getting partially or completely blocked. The airway getting partially or completely blocked. And it can be due to food, toys in our children, sometimes beans and pebbles, stones, little stones, anything. How does choking occur? So we have something in our neck here. We call it the pharynx. The pharynx is made up of two tubes. Just as a train station, when a train is passing, we have where two junctions meet, and one may go this way and one may go that way. That is what is happening in our pharynx. We have one called the larynx or throat, or how do you call it, the windpipe or trachea. Then we have our almighty esophagus. The esophagus goes straight to the stomach. And then the trachea or the windpipe goes to the lungs, the two lungs. Now, this is what happens. God in his own way, as I'm talking now, saliva is gathering in my mouth. If I want to swallow, I have to pause and do what? Swallow. Where does it go? Where does it go? Into the stomach. No, it goes into the stomach. So when we swallow, it goes into the stomach. But once I'm talking, I want to swallow at the same time. What will happen? Confusion will come. So it may try to enter into the trachea or the windpipe. When it enters into the windpipe, what will happen? I'll start coughing. Are we okay? In the same way, when we are eating and we are talking, or accidentally, it goes and enter into the windpipe. That is what happens. Just as Daddy described, my little boy was taking toffee, at the same time, plantain chips, and he was crying. Why? Because I said he shouldn't eat the plantain chip. Are we okay? So while he was crying and eating both, it entered into the windpipe. And it's a life-threatening issue. If you have never seen it before, never pray to see some. I always say that I was trained to know how to handle it, but even in my medical profession, I've never seen some until it happened to my own son. And that is when it's life and death. Please come, let's demonstrate. So in this way, it has happened right in front of you. Sometimes a child may be playing and all of a sudden, you will start hearing noisy breathing, or the child is not breathing at all. There may be drooling. Drooling is saliva coming out. Or the child holding the neck, struggling to breathe. That is how we do it. My sister. Now. Yes, I'm calling for. Thank you. You have done it. Okay. So all of you, you make a fist. Shall we do it? Make a fist. Use the hand that is less dominant. The hand that is not so strong. Use it to make the fist. And use the one that is stronger to hold it. So you have made a fist and you are holding it. Can we all see? Now, I'm going to use this place to bring it out. So it's like this. I've made a fist and I've covered it. So I think you have to get up. It's uncomfortable if you are not choked. So she will be leaning forward like this because she can't breathe. And with my fist, I bring it down here, the sternum. Okay, so between the two breasts, down there, the junction, like where the stomach is, something like that, here. Now, I'm leaning her forward, and then with the fist, putting it under the diaphragm or the sternum. Then, sorry. So, you see, when I did, you see the reflex. So, then you see that it will come like this. So if the thing is in the throat, it will come out. You have to do it about 5 times. But for each, you check and see whether it has come out. Can we all do it? It's very simple. Just make a fist with the hand that is lesser. The one that is dominant, put it on it. And use that side, push it out. Now, for babies. Oh, for babies and toddlers. Hello. For babies and toddlers, you can let them sit down. So this one, I can still do it as she's sitting. Because if it is a child, I will let the child stand on the chair so that she will be at my level. Are we okay? So a toddler or a child will stand at your level, then you do it. Now, if it is a baby, this is what we do. You use this place, the pressure of this place, the heel of your palm. Also bent over. Sorry. Hey, those who have been acting movie, they are doing well. I just hurt her. Sorry. So you do like that. So like this. Okay. Another.
I just want to do it, but you are doing it for the ladies, yes, but for the men. Okay, so just like I'm saying, sometimes we just make it quite easy for the non-medics. So you collapsing, I'll just say hold it for strength, okay? And then you lean him forward, just like she said, just below the chest wall. We want to increase the pressure in the cavity, chest cavity. So your dominant leg, as much as possible, if you do this, you may fall. Especially when the person is bigger than, but you put your foot here, for better posture, and then you do what? I won't press because he may vomit. So like Jesse said, then you do what? You heave. You do what? You heave. So just below that, this, and then you do what? Heave. Hit it. So as you hit, it will just push up. Thank you.
Thank you very much, Doctor. So I've also shown you for babies that you use the heel and then you do it. Now for neonates, sometimes breast milk can also choke them. You can do the same thing or use these 2 fingers, turn the baby. Please, can you help them with the slide so that they see the picture? Use the finger and then the sternum. You press it. Okay, can we see it? Are we okay with it? Please show them the first one for the adults. Good. Are we okay? Please, is it okay for us? Let's move on then. Let's make progress. Now, when the person is choking, things you don't do. Don't give water to the person to swallow it down. It's not in the esophagus, so it won't go down. The water will come out. Okay? And don't panic. And you have to do it for 4 or 5 times. When you are doing it and the hospital is closer, please kindly move towards the hospital so that they will do this. Or even once you are in the car going, continue doing it till you reach the hospital. Because sometimes if you don't do it well, it may fail to come out and the medical practitioners have to help you. Choking is an emergency and you have to do it as early as possible because maybe within the next 4 or 5 minutes, something else may happen. Now we want to go to bends. Bends. I know men are very particular with this topic, bends, because sometimes when they are cooking alone, it happens. Okay, so bends is just when you are introduced to a dry heat, which may damage your skin, and a scald is when it's wet or a steam. Okay, we have 1st degree type of burns, 2nd degree, and 3rd degree. 1st degree is just the redness of the place when heat is introduced. And for 2nd degree, there may be blisters. When I say blisters, do we know what it is? Oh, do we know what is blisters? Blisters is, you see, sometimes when you have burns, there are something like fluid swellings on top. Those are blisters. Okay, those are 2nd degree burns. And the 3rd degree burns are the ones that corrode the skin and they may appear white. You see the white pattern, that one is very severe. There are also some types of burns at specific parts of our bodies that can be turned as 3rd degree. For example, burns around your body, circling your body, at the genital, and many others. Okay. Now, this is what you do when you have burns. What do we do when we have burns? Women, when we are in the kitchen and unfortunately hot water pours on us, what do we do? Oh, okay. What about when a hot cold pot burns you? You were around the training. You was here on Thursday, or you joined online. Okay. So mostly what we see our mothers do, they'll say, go and bring condo. They'll mash it and put it on it. They'll go for mud. They'll pour water on the floor and put it on it. Some will go for egg. Some will go for cold water and all those things, or ice water. They are all wrong. Oh. So this is what you do when there is burns. Call for help. So check the safety. Again, safety, call for help. Then you check whether there is any clothing in the burns, around the burns, or jewelry. You remove them and then introduce the burns to cool water, running water for at least 20 minutes. So you put it under a running water for 20 minutes. Now, if you don't have a running tap in your house, what do? Fetch water. You can add a little salt to it and put your hand inside or your leg. Are we okay with that? I hope you are okay. Okay. So when you do that for a normal or 1st degree, after doing that, you can just go to the hospital and then they will treat it, give you cream and what to apply on it. For blisters, the same procedure, but sometimes you can add clinch film. Do we know clinch film? The women are very familiar. The one we use on, when we pound our fufu, we use it on it. Daraba. You can use it to just cover it nicely. Don't wrap it. Just cover it to prevent infection from getting it, dust, and even maybe flies from perching on it. Then you send it to the hospital. Are we okay with that? Okay. Then, if you don't have the cling film, you can get a nice gauze or handkerchief, clean towel or clean cloth. Also soak it in cold water, cool water, and then put it on it. Now, what you don't do, please don't put butter on it. Don't put oil or greasy things on it. Don't put ice block on it. Don't put in ice water. Please, are we okay? Why don't we do that? When you introduce it to ice water, sometimes when the water is so cold, it prevents circulation, blood from reaching that part of the skin and may cause skin damage. Please, I hope we are okay with it. I want to quickly move forward. Don't also break the blisters. When there is blister, sometimes we are tempted to break it. Don't break it. Then I want to quickly move to bleeding and then our last part one topic. Bleeding is just when there is loss of blood through a part of the body. It can be internal bleeding. How do I know it's an internal bleeding? Internal bleeding happens when it is with the abdomen. The person may vomit the blood, either fresh blood or dark brown blood, or may even pass it through the stool or toilet. Then you know that the person is having internal bleeding. If it is with the lungs, the person will cough it out. So you see the person coughing out blood and you know that this is internal bleeding. Internal bleeding may happen due to accidents or a fall. It may happen due to an accident or a fall. And the person, when a severe form of it, even a head injury, is an internal bleeding. When the person is bleeding into the head, the person may lose consciousness and the person may become weak and all those things. Now, for that, there is nothing much you can do. Call for help. Don't turn the person or move the person unnecessarily. Keep the person calm and quiet, call for help, and then let them transport the person to the hospital. Now, there's this thing that we normally do when there is an accident. We carry the person, one person will hold the head, the leg, and another person will hold the arms, and the neck will be dangling like this. It is very, very dangerous. If there is a spinal injury, you will cause more damage than helping the person. So this is what we do. We do what we call log roll. The person lying flat and we roll the person as if it's what? A log. So we know log. Wood. Heavy wood. So that one you have to look for a flat surface or a wood that is, how do we call flat? You roll the person a little, put it under, roll the person back on it, and then they transport the person. It's very, very important. Now for external bleeding, call for help as usual, and then look for gloves. This is blood. This is blood. So it's dangerous if you just arrest it with your hand. So if you have gloves, put it on, or a rubber, put it on to bring a barrier, and then you press on it. Use the pressure form of your hand, either the fingers or this place, and put pressure on that, how do we call it, bleeding site until the blood clots. But remember, you have to check inside the wound to see whether there is a foreign body. I'll be rushing. Next one is nosebleed. Media, please help us with the presentation more than myself. Okay. So nosebleed is when somebody is bleeding through the nose. What do? It's also simple. Let the person sit, then you tilt the head forward, hold, pinch, how do we call it? The nose, for 10 minutes, 10 or more minutes. Not holding the nose like this, the tip side. You pinch it, you hold it, like in the picture. And then you will see that the bleeding will cease. If it doesn't cease, just get a Vaseline or a shea butter, put it in a cotton or a gauze, push it in, but make sure you leave a appreciable amount that you can easily pull it out. Okay, so we have talked about the bleeding. Now we want to go to the last case, which is cardiac arrest. And the commonest cause of sudden collapse. Media, please help us with cardiac arrest. So the cardiac arrest is just, it means that when the heart stops beating. Please, are we together? Oh, you are getting tired. Okay. This is the last one. Is when the heart stops what? It stops what? Beating all of a sudden. And this one is an emergency. When it happens, the person collapses all of a sudden. You don't have control over your body. So the person collapses. There are a lot of causes of it. Most of them are heart conditions like heart attack or myocardial infarction, drug or substance use. And then when there is an imbalance, electrolyte imbalance, especially when there is diarrhea and vomiting, and you don't do anything. So I want to use this opportunity to also address diarrhea and vomiting. When somebody is vomiting and having diarrhea, the first or the commonest first aid you should give is an ORS. If you don't have ORS, just boil a little water, add a little salt and a little sugar. You have prepared ORS and give it to the person whilst you move towards the hospital. Don't give and remain in the house. Or if you have rice water and coconut water, you can give it to the person. Now, back to cardiac arrest. Those are some of the, how do we call it? The causes. So in our ABC that we did, for cardiac arrest, there is no breathing. There is no pulse. Are we okay? I say cardiac arrest, there is no what? No breathing, no pulse. And the person become unresponsive. When you call him, he doesn't respond. Now, there's a difference between cardiac arrest and heart attack. We have been hearing heart attack a lot. Yes, heart attack is different from cardiac arrest. Heart attack is more or less of circulation, or when there is a blockade to the circulation to the heart. So I always say the heart attack is more of a plumbing work of the heart. And then cardiac arrest is more of electrical. So the electrical, when it happens, there's total shutdown of the heart, and you need to attend to it as quickly as possible. Let's move to the management. How do we do it? Check for danger, check for help, because even electrocution can cause cardiac arrest. Okay, so you check for airway, you check for breathing, you check for pulse. They are all 0. Straight, we are going to CPR. My sister. So this is how we do CPR. It's simple. And don't disturb yourself too much. I'm calling for help. Thank you. So as I call for help, because cardiac arrest is a very emergency case and need hospital attention as early as possible. So when I call for help and somebody is in, I'm not going to allow her to help me that very moment. Please call 911 or call the ambulance. So she's going to call. In the Western world, they have something we call AED, which they normally use. But Ghana, we don't have it. So we will just basically focus on just the CPR. What did I say CPR? What did I say CPR? Cardiopulmonary resuscitation. So we want to resuscitate the heart and the lungs. Cardiopulmonary resuscitation. Are we okay? The heart and the lung. Heart is cardiac, lung is pulmonary, and we are restoring them back to work because they have ceased work. When the heart stops working, pumping blood to the other parts of the body, like the brain and the heart, becomes a problem. So all that we want to do is to do the work of the heart this very moment, so that the little blood that is circulation will reach the brain and will reach the lungs for work to continue as the heart come back. Are we okay? Now, this is what we do. I always say that use your dominant hand first and use the one that has a little strength to clamp it. So you are going to make something like this. We are using this part. Can we all try it? Do like this. Okay, good. Now we are going to look for the sternum. The sternum again. And this time, we are going to apply a little pressure. Okay. We are going to apply a little pressure down there, about 5 to 6 centimeters.
When you say sternum,
they don't know.
We understand, but they don't know.
Okay.
It's the breastbone. Oh, the bone in between here. That's what she's what? talking about sternum. So it's what? The bone in the mid of the chest. When you look at the chicken and other things, that's what joins the rib. So that's what we also have what? Here. So it's in between, please. So when he says the sternum, for us to get it, that's the chest.
Yes.
In between. Please continue.
Thank you very much, Doc. Thank you for your addition. So that is the sternum. The easiest way to do it is to look in between the breast, use the nipples as a sign, and then you meet there. So with the hands move, we are going to compress, move the chest inside. In fact, when the person is conscious, again, it's very painful. But if it's not conscious, you'll be able. They will show us a video. Okay, just after this, please prepare for the video for us. Okay, so you are to press 5 to 6 centimeters down. You are not to move your body. So I am going to look for the sternum, which is around here. Grasp my hand, put it on it. Don't move your body with the person like this. So you have to be straight this way with your, how do we call it? The hand and shoulder. Don't forget, we said that sudden collapse, we are checking for airway, breathing. We have done all those things. So we are moving straight to CPR. Once there, we are going to give the chest compression, 30. So you are going to count. All this should be in 1 minute. We will give 30 chest compression and 2 rescue breath. You are going to breathe into the person. That's why we said you are rescuing the person. So 2 rescue breath, 30 compressions. So it's like this. I've called for help. They are on the way coming. So I won't press much, otherwise you will feel pain. So 1, 2, 3, 4, 5, 6, 7, 8. You count like that. So 30. Then you want to give breath. This is what we do. We tilt the head a little. Please, if it is like this and you give, you will not do anything. Tilt the head like this. Then with 2 fingers, you bring, how do we call it? The jaw down a little. And then you are going to fix your mouth onto it. Yes, mouth to mouth. Thank you. I won't do it. Okay. So when you are doing that, rescue. Okay. Then you hold the nose before you introduce the breath. You breathe into the person. 1, 2. Are we okay? You want to calm down here? Okay. With the men. Okay. So that is how we do it. Compress. So you do like that for, how do we call it? 30 times. Then give a rescue breath, 2, and then you continue. As you do it, when you pump in the air, you will see the chest rise up. Then it will fall. You give the second one, rise up and fall. Then you go and continue with your chest compression. You are supposed to do this. So when you do it and there is a helper, you can let them check the pulse for you intermittently to see whether the pulse have returned, which means the heart might start working, and then the breathing. You do it till the help comes. You don't leave the person. You do it till the help comes. In fact, sometimes in the hospital, we can do resuscitation for hours just to keep the person safe. If you do it and you introduce it as early as possible, you will save the person. But if it delays and you want to go to the hospital before, you may lose the patient. So, doctor will...
Just to demonstrate also for the men. So ideally, Sof Mame did it on a chair. But if it happens, then we are expecting the person to be on the ground. So you would also have to do what? Move to the ground. And like she said, you have checked for safety and all that, foreign objects, dentures. You scoop them what? Out. You'll be able to position or tilt the neck so that there is open. But there are 2 main things that you need to be able to be aware. First of all, you should have in mind, there may not be anybody what? There. And you keep at it till you see that the person has what? Started breathing what? Again. She had mentioned earlier that the electricity to the heart is shut down. And God made it such that it's only the heart that starts on its own. It has its own control what? Mechanism. So what you are doing is to kickstart what? The heart. And like she said, you are doing the 30, okay, plus 2 breaths in 30 what seconds, or we are trying to achieve 120 beats pushings in a minute. So it is not joke. Oh. So it's like you fix the elbows. Let it be what? Straight. You are not doing this. When you do this, you are not getting the power. And like she said, we locate just above, okay, where the breastbone ends, just above it, and you do it. Please, you are doing it, but also be careful you don't use all your energy to break it, because that bone is also what? Soft. So if you are not careful, you do what? You will break it. So she's mentioned your dominant what? Hand, and you are using the heel of what? Your hand, of your palm. And then you interlock it, lock your what? Elbows. So your elbows must be what? Straight. You are not doing this. When you do this, the strength is not there. It's more like you putting your strength, all the strength in your upper body to move what? The heart. Please, are we getting it? And then I will also say this. When it comes to the mouth to mouth, because of these diseases, I'll say when it comes to healthcare, sometimes we do, in quotes, a little bit of, from my language, crazy things. When you want to save somebody's life, and you make sure, so every time when you are walking about, make sure that you are okay. If you have a wound, you keep it what? Covered. So if it comes out, you have to scoop, and you don't have the polythene, you don't have the glove, and your hands are covered, then you can do what? Use it. Are we okay? So you should make sure if you have a cut, don't walk around with a cut on your leg, hand not covered. You make sure it is what? Covered, because you don't know where or when you meet what? An emergency. So that when it happens, you can do what? Act. But if you are fortunate and the gloves are there, the rubber is there. And when it comes to this, please, I even say that if it's rubber they have eaten, I don't care. If the person stays alive, we can treat the person than going say that the rubber was on the floor. Are we getting it? Please, are we okay? So let's have that mindset and don't be too reluctant, because the moment we delay, within 3 to 5 minutes, the patient is what? Gone. Or the person is gone when blood does not go. So for this, I can just rip off his shirt and use that one to cover what? The mouth for me to do the CP what? The breaths that we are given. Are we okay? So please, I am beside him. We've done all that she said. At least I have made sure the neck is in position, at least tilted 45 degrees. I'm using my dominant hand, and I'm using it here. All right? And then I start the compressions. You keep counting. If you are alone, then 32. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. Am I pressing you? Then I have reached my 30. And then we are assuming that I said you rip it off, but this one we are not ripping it off. But sorry. Or even if you have a handkerchief. Nowadays, we don't have handkerchiefs. But if you have a handkerchief, you can what? Use it. But if not, then with the mouth open wide and this covered, then I take deep breath. And ideally, we want you to blow in to make sure the chest has what? Move. So you take deep breath, and then with this, you blow. So I'm not doing it like that. The next time if you have dummies, it makes it easier. So you inhale. You inhale. And then with his mouth what? Open, then you blow in. And as you are doing, you watch that the chest wall is what? Lifting. If it's not lifting, it means that you are not doing it well. So you make sure it's what? Lifting. If it had been in the hospital setting, then they use what? The ambu bag. But with this one, we blow into it and watch with the 2, and then we get back on it. Keep pressing. And for the untrained, even if you cannot do the breath I'll say just keep pressing what? The heart. Why? Because the heart, when it starts, that is what carries the blood that moves. It moves the blood around and it will carry what? The oxygen. So please, even when you cannot do that, then just keep what? Pressing the heart. Once the person had not stopped, the circulation hasn't started, please, you keep what? Pressing it. That's for the lay person. Keep pressing it until help what? Comes. And as you are doing, you can shout as much as you want for the attention to be drawn for somebody to help you. Please don't stop doing it until you see the person is what? Alive. If you stop and say you are going out to cause, by the time you come, the person will be dead. Thank you.
Oh, what if you Thank you very much. So I hope we are very clear with it. There is no need to watch the video again because the time is fast spent. So remember, you are to continue doing it till help comes. Okay, and if you are not comfortable with the breath, remember, just continue to do the chest compression till the person is alive or starts breathing. After the person starts breathing, just put the person in a recovery position and monitor till the help comes. Okay, so on this note, this is the end. Then I want to give it back to Doctor.